doing, buddy? Not bad. No, we're just. It is. Yeah. Yeah. I know. Yeah. Yeah, we haven't had any kids. We have one adult kids. Some of this, they stumbled on it because this BioFire thing, which is the respiratory viral panel, like Sullivan has it and Greene County has it. This thing it's an amazing system. You literally get a mucus sample and expectorated specimen is spit into a cup, and they run it. It picks up 20 different viral. It's called a BioFire. I don't know. I tried to get us to get it, the regional. And yeah. So BioFire does not have COVID yet, but they're trying to add it to it. But it's a respiratory viral panel. I was looking for it at the regional doctors about it. He said, yeah, Sullivan County's got it, Greene County's got it. And if you get a patient transfer from Sullivan, look on there, you'll actually see a respiratory viral panel test for human metapneumovirus, parainfluenza, influenza, RSV. So we stumbled onto a lot of these people. So there are some positive without medication as well. I know it. How are you, girl?
I'm good. How are you?
Home. What's
Living.
his key?
Where? Oh, give those to Valerie or Lindsay. They're for the property that we had.
If you want to turn on your
Yeah, health
your
south.
microphones, please. Okay. Dr. Turner, there you go. Can you please turn on your
Oh,
microphone?
you're.
Thank you.
My
Thank you.
pancreas divisium.
If you wanna
Let's
hit
call it
that.
what it is.
Will do. Record.
Divisium.
We're running.
It hasn't flared up or anything since the original one. I don't even know what made it flare up, and
Yeah, so
that's what he said. And he said if it does, that I could go and have a little stent put in that side duct.
who'd you see?
Gromsky. I researched all of them, and that's who I wanted. He said, I'll never see you for your liver. So because the assistant runner, nothing that concerns me. He said, we'll keep an eye on it. If it bothers you, you can come back in with the papers. Jimmy McCann. Bye, Evercat. Bye.
I've been on those guys over there, and there's a few of them that are like really, really good to deal with. Some of them are not.
Yeah, that's a medical student. It's in here. You're downstairs. What she was at. Do you use this? And I said, first of all, never assume anything. And yeah, and then I said, second of all, if that's a question you have to ask, don't apologize for it. If that's a question to help with the diagnosis.
Ready?
Before we start, all counselors. Responsibilities. Good evening. Hello, everyone. I think we'll call the meeting to order. Could we all stand for the Pledge of Allegiance, please? Pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Wanda, may we have the roll call, please?
Dr. Turner,
Present.
Jeff DePass, Dr. Lim, Dr. Caddick, present. Dr. Ross, Dr. Todd, present. Mr. McKenna,
Present.
And is there an approval for the minutes of the last April 21st meeting? Is there a motion?
Motion to approve.
Okay, motion to accept,
Second.
and a second. All those in favor?
Aye.
Opposed? Motion passes. Financial report, Rhonda?
Okay, as you can see, it is the third page back. You're going to see the immunization grant is in the negative, but that's because we've not received a payment from ISDH yet. Okay, we have inquired about that. Other than that, do you have any questions for me?
Any questions or concerns?
Good evening, Dr. Lim.
Good evening. Sorry.
So we'll move on to the health officer's communication with Dr. Brecken.
Nice to see everybody. Obviously, trying to stay busy with the evolving Delta variant and the uptick here regionally as well as across the state and across the country. Obviously, we're dealing with the same things we've been talking about for weeks with the falling interest in becoming vaccinated and the high percentage of people walking through the ER doors that are hospitalized, that are unvaccinated. So we're still trying to beat that drum. I don't know as far as our messaging, if it's just falling on deaf ears at this point, but there's lots of new promotional materials that people are talking about now where they're showing x-rays of vaccinated COVID positive versus unvaccinated, and they're just breathtakingly different. So I don't know if we have to resort to scare tactics or what, but we're still, you guys see the information coming out from the state. As far as the percentage of deaths from COVID, 97% are unvaccinated people. They're still trying to figure out if Delta variant is, we know it's more contagious, but they're still trying to figure out the data points to say, is it actually more, not necessarily more deadly, but is it more detrimental to people? Does it cause severe disease? And no one's ready to say it yet. I'll say it myself. I've seen it now firsthand, and I've got young people that are really, really sick with it. And I just got off the phone with a lady. We're starting to see younger people now, and when I say younger, I mean school-age kids being hospitalized all throughout the country, particularly in low immunization pocketed areas like Missouri and Alabama, and that's a big concern. Our vaccination rate around here is actually pretty decent. Could obviously be better, but when you look to our neighbors all around, we look at those rates, and it is a direct correlation. So, big concern. So every chance we get to beat the drum, pro-vaccine, we need to be beating that drum for sure. Outside of that, I haven't had a whole lot of direct interaction with people at the state level as far as direct communications. That everything is coming out in buckets and buckets of information, and we're all just weeding through it the best that we can. There's been actually a relative paucity here lately of a lot of new studies and things coming out. Everyone's kind of resting on our treatment programs, our algorithms. Nothing really new has popped up.
How's the admission in the hospital now?
They're going up slightly, for sure, at both hospitals.
Because there's a new strain coming now. It's instead of Delta, it's Lambda now.
Mm-hmm. Yeah, that's everything that they're still watching all of these variants of concern before they label them as a VOC. I mean, the data from the UK is pretty dumbfounding. There's been over 2,000 variants already identified. So,
Do you want to speak about RSV?
so yeah, and you can weigh in here
Sure.
too, Jim, for sure. So RSV, we deal with RSV. It's a seasonal virus, respiratory syncytial virus. It's always been linked to young kids, toddlers, babies, causing severe pulmonary disease. And we see hospitalizations for it all the time. Every year, it's very, very seasonal. It does affect adults as well, and we're stumbling upon some RSV positive kids and adults right now. I think it's probably a direct, in my own opinion, and it's uneducated opinion of mine, but probably because nobody's masking, so respiratory viruses are spreading like crazy right now, and everybody's back together. But we are seeing RSV at an odd time of the year, and maybe we're picking up on it because of extra testing. But it's that's a bit of a concern. We do not want to shift a seasonality-based virus to a different season. That's a problem. So,
Jimmy, do you mind putting your 2 cents in of 20 years' experience with RSV.
Oh, yeah. I mean, as Dr. Brucken said, and he knows quite well, it's usually a virus that we see in the wintertime. We see it a lot in young kids, pediatric patients, and sometimes symptoms are mild, but they can progress quickly. This area, we don't have a intensive pediatric ICU. We don't have services like that at either facility. So a lot of times we monitor symptoms, and as they progress, we usually transfer these patients to Indy. We've actually done that a couple times recently. So
We've had 2 children go to Riley.
I don't know exact numbers.
Well, the issue with RSV is, as many of you know, it's mainly a problem for children because of their anatomy. We may have talked about this before, but I told you about 2. Our bronchial tree, it's more like hard cartilage pipes. For little children under age 2, they're like little rubber hoses. And so they get that mucus, and in their bronchial tree, they can't cough it out. And so what babies present with is this sort of a wet, choking cough. I always ask mothers, did the cough frighten you? And if they say yes, that's a strong indicator for RSV. I thought last night about going to the hospital. The cough really frightened me. That's a strong indicator for RSV. Children are retracting. They're pulling their ribs. Usually some low-grade fever, runny nose, kind of miserable. Not uncommon. They have an otitis media thrown in there with it. But it's really because of their anatomy. As we get older, it doesn't affect us nearly as much. So the other challenge I want to mention is, because we're talking about RSV, I know we've had one day, it's kind of going through daycare centers right now, but we had a case this past week where in this one daycare there were 6 children who tested positive, and the family doctor in charge of one of these children decided to test that one child for COVID. It turns out we have a child now that has RSV and COVID at age 2. So this opens up a whole different issue. I actually sent an email to Dr. Box, the state health commissioner, today about this, and I've talked to some of the staff here and the pediatricians at the hospital. So the thought may be that over the next several weeks, when we see children come in we think have RSV, to swab them for COVID also. Because that 2-year-old can then be the vector that will take it into the home. Just like influenza traditionally does during the flu season. It's during the school-age child. You know, the average flu season, you talk to teachers, the classroom's half empty. So those kids are taking it all home. The same thing could happen with these children who are carrying both viruses. And then the concern would be, how sick are they going to be? Now, from my understanding so far this year, the RSV has been a fairly mild strain. When I talked to Dr. Holder, the head pediatrician of the union, they had not had to send anybody to Riley, and nobody's been intubated that they know of so far, the children here locally. But the combination of 2 theoretically deadly respiratory viruses is a real concern, and so we're going to definitely be on the lookout for it, and we'll probably encouraging physicians, if you go to swab somebody for RSV, or you're swabbing their nose, just swab it for COVID and see where we're at, and see what kind of numbers we come up with. Because it could be a whole new something for us to be concerned about. And the problem with RSV, what is the treatment for it? We don't have one. Steroids don't help, antibiotics don't help. Some people say nebulizers help, but it's never really been shown to help. Really, it gives kids a fast heart rate and kids don't do well, so it's really supportive therapy. So you have a theoretically deadly disease, but we actually have no treatment. Most of us feel if children are young, under 4 months, probably need to come in the hospital overnight to watch them, put them on a pulse oximeter, see if their oxygen levels do, because they can bottom out and you can die from this disease. So we've got a lot going on in public health. We need a lot of awareness and, to be very vigilant.
Can I ask a question? You talked about just some concerns, potentially the next few weeks, and then listening. That's very serious. In terms of our communities, such as our local schools, we have universities here, colleges, and I know you do a lot of activity with coordination. Any just updates or news in the next few months, what to expect?
As far as the schools, IPS sent out their recommendations about masking and different things. That's been a point of discussion here locally, obviously, with the school board and things. Higher education people they can make their own laws, their own rules, types of things. So everyone is looking to Vigo County's release that they've already put out about what they're going to do with masking and things. when I spoke to people from the school board and to the administration, it's constantly with one eye looking ahead and looking at other places to see what's going on. Because everyone thought we got back to fall, everything's going to get back to normal, and clearly that is not the case. So, and to try to, anticipate these pitfalls before they arise is where the planning, lies right now. Vaccinated people after an exposure don't have to be quarantined. Unvaccinated people should have a mask on around other unvaccinated people, but it's being recommended but not mandated. Now, the Marion County School Systems, I guess, put out something today to make it a little bit more stringent, which was good. Most school systems other than California are recommending masking. So, personally, we'll just have to see. I mean, there is no precedent that's been set yet because we haven't been back in this situation just yet. But the stars are aligning for a potentially bad fall here pretty quickly with the variant, and if younger kids are getting, younger adults and younger kids, they're the highest level of unvaccinated people. They're going to get sicker. We're going to have to keep examining that very, very closely. I know ISU and Rose-Hulman, everybody is looking at what are we supposed to do. And the colleges that have launched forward and said you have to be vaccinated to work here and be here, immediately lawyers have drugged them into the courts, and IU just had a nice victory. But places like Notre Dame, they said, if you're going to be here. Rose-Hulman says, I don't know if you guys are aware of it, from my impression anyways, you don't have to be vaccinated, but you're going to have to pay for your own weekly swab if you're not vaccinated out of the pocket. So you're going to get tested weekly, otherwise you can't be on campus. So, which is fair, or get vaccinated, because, the vaccination. Yeah, until FDA approval. And hopefully Pfizer, initially I had heard like September 15th, Pfizer was supposed to be applying for their FDA approval for their vaccine. And then you can mandate a lot more things because it's no longer under EUA. So we'll just have to see. The sand is still shifting underneath our feet, though, is the thing. So
There's that constant communication. It's so important. Like, we met yesterday with the school corporation over in our clinic and went over things like what's contact tracing going to look like now, because we're already having positives in some of the sports teams that are practicing for fall sports. But looking at even sending out messaging to the parents saying, if your child is vaccinated and has no symptoms, 12 and older, and has no symptoms, they don't have to be quarantined. So, kind of using that, but because the quarantine seemed to be the sticking point, and even we had a conference call with Dr. Holder yesterday, the big complaint from parents are the quarantining, and also the missing of the extracurricular activities. So that may be, as parents are really thinking about going back to school and their kids playing sports or what other activities extracurricular they do, that might act as an incentive, because only about 14% of our kids 12 to 18 years of age are currently vaccinated.
Well, you talk about FDA approval, but, in reality, we've given 340 million vaccines in America, 2.2 billion worldwide. That's a pretty well-tested vaccine, when you think about it. And so this wheels of government to grind on, that's kind of what it's all about. But the numbers are there. I mean, we vaccinated half our population.
Yeah, they did say, the article I was reading about a week or so ago was that because of that data pool, that no one has ever submitted for FDA approval with that kind of data background, ever. So it should be pretty much a, yep, looks good, let's go type of thing. They would have done it from the get-go, other than EAU, because it's a whole lot quicker to get EAU, emergency use authorization, than it is for FDA approval. So they needed to get shots in arms. So I hope they take one look at it, rubber stamp it. I mean, you can't argue with the safety, you can't argue with the efficacy. So and that could be a game changer for businesses in particular, whose lawyers running their deal have said, HR people, you can't mandate vaccine until it's FDA approved. So it could shift things pretty quickly.
Shall we go to new business?
Sir, thank you.
Is that you, Joni?
New business A will be Ashley Stewart.
Hello.
So, me and Ann Stamper have been working on the plan and budget for the COVID-19 vaccination increase, getting more people vaccinated. We have process objectives in place, which include project management, promoting the vaccine, providing direct COVID information, conducting direct outreach and vaccination to minority populations, as well as partnering with community health workers to reach vulnerable populations. So right now, we're just kind of working on things. We have created brochures, which are included, that we've been handing out. We've handed out probably 1,100 of these in the past 2 weeks, as well as we ordered these 9 reasons to get your COVID-19 vaccine, which is very informative and had a lot of good information. So we figured the faster we could get something out, the better. Our goal is to get more people vaccinated, and we're hopeful that we're capable of doing that.
We were one of the few counties that received this funding for the $221,000, and it is to reach those hard-to-reach populations. One of the things that Ann Stamper did was reached out to all the members that were on the Indiana Health Disparities Task Force, got lots of positive response, giving us best practices, ideas that we can implement in that work plan. So I'm hoping for good things between now and June 30th of next year from this funding and from the work plan they've created, their outcome objectives, their strategies, bringing partners to the table, and looking at evaluating, is it working, or do we need to change how we're doing things?
And the things we've done have been pretty successful. We've had a few question and answer sessions at the Lighthouse Mission, as well as the Senior Center, the Wabash Valley Senior Center, and tons of questions, giving good answers, and getting people more hopeful and more likely to get this vaccine in their arm and not be so reluctant and scared. No reason to be scared.
Do you know if there was any discussion about moving vaccines into private physicians' offices?
It's already happened.
It is happening. They have to sign up for it.
We have some in our office, but we haven't started offering it yet. I think it's a paperwork issue or something. I'm not sure why, but the hospital brought them over, but the Moderna, but we're not offering them yet. I'm not quite sure why. And I don't know if there's any private doctor's offices in the county that you could, part of the idea with the vaccine was you trust your family physician. He's
Yes.
immunized your children, he's giving you your pneumonia vaccine. And so if you can get the same shot there, would that increase the,
That-
are you guys doing it at Family Medicine?
Yeah, we're doing J&J.
Are you, so you've been pretty successful, or do you know?
I think somewhat.
At least you're offering it.
We're offering it, yeah.
Okay.
Yeah.
That's good to hear. Thank you very much.
I will say, everybody that I've taken care of recently here in the hospital, including a gentleman who's been with me now for a little over 7.5 weeks, hospitalized, still on 50 liters of heated high flow. He can't go home. He can't go to a nursing home. So everybody has said the same thing. They say, number one, I would never wish this on my worst enemy. And number two, I wish the hell I'd have gotten vaccinated. Every single one of them have said that. So, and, folks are missing, maybe they're not dying from it, but, this guy, people are losing their spouses from it, and people are missing work. I have a 49-year-old that I discharged today. He'll probably not work for 4 to 6 weeks. So, and he's the he's the breadwinner for the family, so, just stinks, but.
Do we have any of those patients telling their stories? Because I feel like sometimes that hits at the heart, which is where a lot of these decisions are being
Good
made.
idea.
Yeah.
It's in our process objectives to
Okay.
reach out and get PSAs out from people. I had a 14-year-old I contact traced a month ago, and she had to be admitted to Union, placed on oxygen when her mom was an ER nurse. She still had to be in Union for a few hours, and they eventually sent mom home with her, but they said if you have any more issues, you need to get her to Riley as soon as possible and to pick you. So, scary. It's scary, and it's almost to a point where we need to start scaring people because it is real, and it's not a joke.
Are there, besides unvaccinated, any local just places or organizations, groups that you're most concerned with? I don't know if it's homeless or school-age children. I have no idea.
We are starting to focus now, like our first process objective is going to aim probably towards Vigo County School Corporation children. So we're going to be in attendance at orientation for middle school and high school, just to give out information, get that out into the school, let the parents read it, make them think about it again. I think everybody's thought about it, but a lot of people made their decision early, and now that we have the Delta variant here, I think they're going, maybe I should have gotten vaccinated. So I think the more we push it, the more likely they'll be to go get it. Get vaccines in arms.
How do you do contact tracing now? When the
I'll
concept,
let the nurses speak to that. If you'll hold that question.
I know, but one saying, I'm just
Okay,
want to
sorry.
pose this question. The concept of contact tracing is if you are seated beside me, a few feet away, that you might be exposed, and I'll tell you, if I have COVID, I'm in this room, I'm spreading it into the air, you guys all exposed, even if you're not near me. So the concept of several feet is not true anymore because the virus stay in the air for a couple of hours, you know. I might have left the room, but you are still all exposed, you know. So it's kind of hard to do the concept of contact tracing into just 6 feet away people, you know. It doesn't do that anymore, you know. I mean, the only reason you're wearing mask is, well, I have COVID, I probably will not spread, or maybe some of you who are wearing masks is not gonna get it, but it's in the air, you know. And that's been proven. It's airborne, you know. It's not you know, direct contact.
And also, Dr. Todd, we'll continue to go into the jail, we've worked closely with the jail commander to do the incarcerated and offering them the J&J. We've had dialogue with one of the local bars that have talked about doing a shot for a shot. And yes.
That's great.
Right, it is. Yes, to reach the younger populations when they come back to school. And it's a popular place. And so that might help us with the, you know,
College.
21 and to whatever age kids or young adults. And then I know that Ann and Ashley have reached out to two of the major owners of the Mexican restaurants in the Wabash Valley and asking them for advice. You know, how would we reach a lot of the Hispanic population, especially those that are undocumented? But just looking at all kinds of different strategies to reach hard-to-reach populations and continuing to work with Hamilton Center and PATH and Mental Health America to get reach the homeless, along with the Homeless Coalition.
So if you were going to do that at a bar, you went to a big family dinner and there were 50 undocumented workers there, do you require any form of ID, or you say, we're going to give you all a shot? I mean, is there say you go to a big family dinner, there's 50 people there, and somebody calls and, can you vaccinate us, we're all ready to go? Is there paperwork for each person, or they have to have some sort of ID? How do we vaccinate?
Same way we do at the jail. We don't have an ID for them. We use the jail's address. We take their information down.
Basic name and that's about it, or then go for it?
There's questions that are asked during intake. We would ask them, is there anybody in here that has gone to the jail to do vaccine? Okay. And you want to speak a little bit about it? Yeah.
Exactly.
Which is the same process as when we go into Hep A.
Yeah, potential pitfalls, you know, everything has to be reported to Veros if there's a complication or a side effect. So I'm sure there has to be some sort of paperwork trail for it type of thing. But certainly break down a lot of barriers, yeah, agree. And Grandma Jane just stood up back there. She's hot on the trail again of some long-term care things again. That's another, to speak into your point, Dr. Todd, that's another area that we're watching because we're starting to see a few positives pop up in long-term care again. And there's been several in other states that have had pocketed even in vaccinated individuals. And again, the vaccinated residents are faring very well. The unvaccinated residents are not. So again, just speaks to the same tune.
And it's not required for a lot of staff members working.
Correct. There are some that are.
You know, along that subject, there's a debate in our local hospitals as well as with the Indiana Hospital Association about mandatory vaccinations for hospital employees. And it's brewing right now, what's going to happen with that. And, you know, it did work for influenza, as you probably know, but our leadership, I was in on a phone call with them about what we're going to do about that. I don't think a firm decision has been made. I don't know about a regional or whether, I cast whether the hospitals in the state would just do it together, would all mandate it at one time together, show unity, so people wouldn't jump ship and go work somewhere else and so forth. So that debate's brewing, and it's got a little controversial for some people.
Yeah, there have been healthcare systems that have pushed forward, and they got, Houston and actually a couple of them in Texas now, where litigation immediately got fired up, and the courts have stood behind the hospitals for doing it, and throwing things out. So whether or not we'll get there here locally, who knows?
Because we have not done well with hospital employees.
No.
With the healthcare people.
Across the country, you're less than 50%.
We should be the leaders, really.
Yeah, the same for long-term care staff. When it's not required, it's less than 50% have opted into vaccines.
Joni, do you want to go to the strategic plan?
Absolutely. One of the things that I started looking at before COVID was a strategic plan for our health department. In fact, I had gone online and printed up several strategic plans for other health departments in Indiana, and then, which they've sat on the corner of my back desk since February or January of last year. And so that's something I'd like to do, is put together around September, because I want to kind of gauge how August goes with the vaccine and back to school. But I'd like to put together a task force of our staff and any of the board members that would like to participate. And you don't have to go to every meeting or anything like that, but stay up to date. But I took the strategic plan, how to guide, from NACHO, which is our National Association of County and City Health Officers. And it lays out best practices. And I also went ahead and printed up Indiana's most current strategic plan, which is from 2021 to 2025, and then look at what's important to our state to change. What they've assessed as important, and what kind of objectives they have, and what kind of strategies, and who we need to bring to the table, and how we would evaluate it. I printed up some that are not lengthy, but very solid and effective, like St. Joseph County. And then there are some that are more lengthy, but I think it's just looking at a plan for our health department, and looking at whether it's a financial plan, looking at our programs that we are mandated to do by administrative code, those that we aren't. And then, of course, making sure that we're not going to do duplicate programming if it's already going on, but still identifying those areas of need. So I just wanted to bring that to you, and it's something I would like to see done, completed by the fall of next year. I know that for the school board, it took us about a year to develop our strategic plan, and it's been very helpful to guide us along as situations arise, and then knowing when to modify it. Any questions?
Happy to help, though.
Thank you.
As am I.
Thank you. Okay.
Joni, is there something on the 2022 budget?
I emailed all of you the budgets, got some feedback, some questions, some wanting additional information, so to understand some historical data on our budgets. But those are our proposed budgets, along with a budget narrative as to why we would need some additional increases. We always like to provide that to the council so they can see why we're asking. You know, some years it's that we need a new XRF to do our lead assessments in homes, which can be up to $25,000, and some years it's new vehicles or new equipment.
I was going to ask you have a question? Did I read it right that it seems like the vector control seems to be the biggest, to be the largest increase, kind of the extra expenses for 2022?
Yes.
I would just wonder if you anticipate any pushback on these, or if there's going to be some other pots of money, like COVID-related pots of money that's going to help with some of those?
Not that I'm aware of, but as I look at through the Indiana Associations of Counties, is that what it's called? AIC? They send out newsletters, and it's basically for all municipalities. But the usage of the COVID funds that we're getting are wild. They could be for lead programs. Of course, that's not going to be for us to decide. It's going to have to be for our policymakers, the fiscal and policymakers. But I'm hoping that they'll look at those kind of things, and because definitely those dollars could work for programs that we do here. And I can actually send you that document, the one that really laid it out, because I was like, I even went to Marcy Shaw that does our lead, and I said, I want you to look at this. We could actually use this for lead.
I know the county is getting a chunk of money again, and.
Right.
I just, wonder if there would be, we would be able to say, hey, can we use this?
Yes.
I don't know if departments are putting in requests special for that funding.
We haven't received any guidance on how that process will look like, but even, I'll just go back to the lead, you could even use the funds to abate houses that have lead paint in them.
I thought I saw something, correct me if I'm wrong, in the news already that, and I can't remember which department or program was already saying we may ask for funding related to this coming out of that COVID. That's why I thought, I just wondered how the process would be for departments to actually say, can we use it in this way, to kind of be a little ahead of the game, I guess.
Yes.
Yeah.
I can definitely put out a hook and see.
I saw the vehicles, and yeah, I definitely, you need some more vehicles, considering what you're using the best you can right now. So.
And it's interesting because Commissioner Kearns took a photograph the other day of one of our old, what kind of truck was it, Ford? An 84 Chevy that he was driving around, and he said this is, indicative of the compound because they take such good care, and this thing is in pristine condition. And when we do get a new vehicle, we will punt it over to another department that might need, whether it's highway or maintenance or whatever. But it is, our vehicles, when they finally leave our nest, are just really so well taken care of. We try to get everything we can out of them.
Any more questions? The next is action items. Joanne, should we do all 5 of them together in one
That's going to
vote?
be up to you guys if you'd like to, if you want to
Shall we
separate them
start
out.
can you help us with the general health fund? Is there any comments from leadership on that? Can we have a motion to approve the general health fund?
So moved.
Have a second?
Second.
All in favor?
Aye.
Opposed? The item passes. The second is local health maintenance. Is there a move to accept that motion?
So moved.
Second? All in favor?
Aye. Aye.
Motion passes. The LHD trust fund, is there a motion?
So moved.
And second?
Second.
All those in favor
Aye.
and opposed? Motion passes. The donation fund, motion please.
So moved.
Second?
Second.
All those in favor?
Aye.
Opposed? Motion passes. immunization grant. Motion
So move.
and second.
Second.
Okay, all those in favor?
Aye.
The motion passes. We did really good. We did a great job. Any old business under the COVID-19 response update? There's some, okay.
Chelsea Willis.
Hi.
Hi, I'm one of the nurses in the clinic. So we moved the vaccination clinic back up to the home clinic up here from regional. Of course, vaccine numbers are down, but we offer all 3 of them 5 days a week. Appointments or walk-in. We've gone out to some outreach places, between the jail, some of the food shelters, food banks, Lighthouse Mission, just trying to hit soup kitchens. They're trying to hit the places that have a hard time coming in. We did the Homebound, which Andrea led. We've hit almost everyone on the list as of where it stands now. I think there were a few that just won't return calls or have changed their minds, but most of those have been hit now. And we continue to contact trace every positive that comes in with our 4 tracers and Jane and I.
Have you seen any, like we saw before, clusters like a wedding or a party or a funeral? Have you seen any of those lately?
Not really. We did have a camp. Most of the campers didn't fall in our county, but we did hear about it, that they had a few cases, kids and camp leaders that came up positive. So, but they have since shut down, sent everyone home. Plan to reopen again in September with more guidelines in place.
Thank you for what you're doing.
Can I ask you questions? Do we need the parental guidance, consent for young kids vaccination, COVID vaccination?
Yes, the parent has to give consent and sign the release.
And one of the questions that I asked our district epidemiologist, what is considered an outbreak in a school or a classroom setting? Because that was a question that the school representatives asked yesterday. And she replied back, for COVID-19, she said, right now it looks like it's going to be 2 or 3 cases that are epi-linked, but the state would give out more firm guidance this Thursday at 10 a.m.
When you do the information sessions at the school orientations, are you offering the vaccines then? Or was that not, just the information session? Okay.
Just the information session we have set up before to go in and vaccinate, which I'm sure we'll probably come back around and do again this year.
Yeah, we went into all 3 high schools, because at the time that we did them, it still wasn't for 12 and up. Or maybe it was, but there's too many fainters among the middle school kids. And so that's just one of those things historically, we haven't gone in and got them. But yeah, that is something, again, with that strategy of saying to parents, if you don't want your kid quarantined and we want them to keep doing extracurricular activities, get them vaccinated.
Thank you. While we're on that topic, I'll just mention briefly, I checked with some of the leadership at Union today, up in the COVID unit. Since the vaccine came out over the last several months, we've now admitted, at least at Union, 127 patients with COVID. Of that group, 5 people were vaccinated. 2 of those people were over 90 years of age.
Yes.
So basically, the number shows locally as well as statewide and nationwide, it's literally 98 to 99%. If you get vaccinated, you do not go to the hospital. I don't know what stronger message you can give to people than that the vaccine is effective. And the few people who have contacted, most likely the Delta variant, they're still getting kind of sick and headache and body ache and so forth, but they're not going to the hospital. So that's a huge thing. Because once you go to the hospital and Jimmy has to take care of you and Darren, you're in trouble, and you may end up with scar tissue in your lungs that you never get better from. So the vaccine has been very, very effective. The one thing I've not been able to understand when you watch Dr. Fauci, on TV. I told another group that when I went to medical school many years ago, when we still had books, we had books then, and our biggest book was internal medicine. And when this whole thing started months ago, I glanced at my book there sitting on my shelf. Fauci was one of the authors. Really? So I looked in, it was Anthony Fauci. 1986 edition of Harrison's Internal Medicine. So I flipped through, what did he write 30 years ago? Coronavirus. He was a world expert 30 years ago. We had the best guy to help us through this. Can somebody tell me why that person had to have security and bodyguards for his family? A worldwide researcher, one of the smartest people in America, first in his medical school class, not a political figure, not controversial. How did things change that he had to have a security for himself and his family when all he was trying to do was help people through this tough time? And well-respected World Health Organization, everywhere else. Isn't that a strange feeling how we got to that when you have someone like that who had no other motive but to help people? And we had to put armed guards for him. So kind of a sad story, actually. Anyway, shall we go to program updates? Vector control, Mike?
Good evening. We've been busy, as you can imagine. As Dr. Turner and I were talking earlier, mosquitoes are out of control right now. They're bad. We've had enough rainfall that the river bottoms is all flooded out, and people's got water in their backyard, standing, whether it's children's toys, rain gutters, etc. And it seems like I'm getting calls from about everywhere in the county. But along the river is really tough right now. And over in West Terre Haute. Now, I've thrown it in there for Rhonda's sake because she was kind of giving me heck earlier.
We had the wettest June
Yeah.
on the books.
Yeah. But we're getting them under control. But we've been busy. We participated in the city cleanup back in May. We distributed approximately over 5,000 coloring books, Skeeter Beater coloring books to elementary school kids. We're still taking tars from the public. We're on our 7th trailer.
53-foot trailer.
Yeah, we're keeping that up there. Treated all the catch basins, and we had some help with that, and I thank Joni for that. We started our larviciding program, of course, and our adulticiding program. They're both going full blast. We started our surveillance program. We have had one positive pool of mosquitoes. It was detected back on June 25th. It was a pool of 18 mosquitoes, which really doesn't make a difference because all it takes is one to be positive out of that 18. And the whole pool is positive. So far, we're the only county in the state that has had a positive pool. I don't like that no more than anybody else, but that's why we do our surveillance, so we know if it's in our county or not. And unfortunately, we do have it in our county. Any question?
We had any media stuff go out about the West Nile, about mosquitoes?
Yeah, Ronnie's did some PSAs.
Good.
Yeah.
Wonder if it'd be helpful to actually have somebody like you or your guys going through somebody's backyard and explaining this is what you need to do and message people to patrol their homes.
It'd be hard to get them to let us in their backyard.
Yeah. So,
We had that today. We went out on one complaint, and it was supposedly the pond, and it ended up not being the pond. They had raw sewage in their front yard. So, people don't want you on their property. They just, it'd be nice to take them around and show them, Doctor, because, like I said, even children's toys in their backyard. I have a neighbor that's got 3 children, and they have a backyard full of toys, and I have mosquitoes. And I can go out back and just look and see the water standing in them, whether it's the little vehicles that they all ride in or, their sand pails or whatever the case may be. People don't realize it, but it just takes a little bit of water in a bottle cap to breed, thousands of mosquitoes.
When I lived in the city, I would walk my dog up and down the alleys And that may be something we could shoot because it would keep from showing somebody's front of their house or actually going into someone's backyard. But you can see an awful lot just walking down alleys.
Oh, yeah.
And I lived like on the 200 block of Barton, so, and I would see them all the time.
Yeah.
Things, and I go dump them over. That's the public health person in me.
I think that the messaging was so strong about tires that, people picked up on that, and people still talk about tires, but I just wonder how much of the common items laying around people just take for granted.
And
Yeah,
how
we
small.
still are getting a few tar complaints, and that's good. We're going out on those. We went out on one of those actually yesterday. Guy had about 40 of them in his backyard. So the public is aware of that, thank God.
Yeah.
But I just don't think they pay enough attention. And I was hoping the Skeeter Beater coloring books would, bring that to their attention because it has all the little things in the coloring book for the kids to see in your backyard. Because, rain gutters, all of it, it all adds up. And when I get the call from somewhere in the city and it's not anywhere near a lake or a pond or the river, it's somebody's backyard, whether it's a contaminated swimming pool or whatever the case may be. But, yeah, it'd be nice to bring it to their attention, get a little action on it. We'll see.
So,
Any questions?
if you have a fund moving, how long before the mosquito finds that? If you have a pool of water somewhere,
Oh, it doesn't take them very long at all. What they're going to do is the female's going to seek a blood meal. As soon as she gets the blood meal, she's going to seek that water and she's going to lay her eggs. And it takes only about 7 to 10 days for them to hatch.
so a little movement disturb them, like you mean, or
We found larvae in mud puddles in the alleys where cars actually drive up and down the alleys, and it won't bother them. They're still breeding in the mud puddles. Now, when they do see movement, yeah, they go to the bottom, but that's not going to keep them from breeding in that water.
how long does it from larva stage to like,
To the adult stage,
yeah, how long it
7 to 10 days, depending on weather. Yeah. So, and we had enough rain in June that it just seemed like right after another, it just never let up. But like I said, I think, we've got the guys out there all day and we've got the people at night. It's not the first year we've had it. We're getting them under control. It's just, they're bad right now. Any other questions?
Appreciate all the work you guys are doing
Thank
after
you.
hours. Take
Thank
care.
you.
Thank you. Nursing Division?
Hi, I'm Twyla. So I'm just giving the report on the clinic side of it. We did open up on March 1st to our normal clinic activities. So we do lead testing, TB tests, immunizations for all ages. And then we also do case investigations on communicable diseases and TB. We follow the latent TB and dispense medication for them, and haven't had an active TB recently, which is good, mostly latent. So, any questions?
I was curious, you had a couple of Campylobacter
Yes,
and as well as Salmonella.
yes.
Is that a local or you target it to any place?
We did not see a pattern, so we will call, Chelsea or I will call and try to get an intake of like their water sources, if they've had any anything with pets, any livestock, anything like that. We didn't see any common factor among any of these. And these all get sent to the state, and then the state will also look at the species, the types, and then also put them together with other places in the state to see if there's a commonality.
Sometimes foreign travel.
Yeah,
cruise
those are
ships,
questions.
those,
Yeah, we ask all of those questions too.
Don't see Salmonella very often. Or Campylobacter, I mean.
We're actually seeing, yeah, we see it.
Maybe we don't do enough cultures.
Maybe,
We just
I don't know.
assume it's a viral gastroenteritis and don't culture people, you know,
Yeah.
maybe like we should, so.
Yeah.
Thank you.
You're welcome. Any other questions?
And we're,
I was going to ask, I looked at the childhood lead poisoning. The new cases, 3, is that in this quarter?
That would be this quarter.
Is that pretty average? I didn't know if that's,
That's Andrea. I don't know if that's normal or not. Do you know, Kelsey? So,
for that time frame, but we noticed during the summer months, so when we go to our October meeting, you're going to see that there's much, much more as kids are playing in the dirt and other sources of lead contamination, but usually it's from the exterior windows, and I know Mandy's certified lead specialist. Would you agree with that statement? Yes.
Thank you.
And we're hoping to start back up our travel vaccine clinic.
Nobody's traveling, so.
I know.
Vital statistics, please, Loretta.
Hello, everyone. Brother couldn't be here. My name is Brooke.
I'm sorry.
It's okay. So you have our report in front of you. Everything's pretty normal. The drive system for death is getting a lot easier. There are, believe it or not, still doctors signing up for it, even now. But like I said, everything's going really well. I've had 409 deaths in this quarter, and out of those, 19 in this quarter were COVID related. So they've went down substantially.
Jessica Kiger has been gathering up, she does births, and she's been gathering up the information for Union Hospital for their maternal child grant, because we have a read-only screen that is just a treasure trove of information that helps them gauge whether they're hitting their benchmarks or what areas they need to focus in on. I know it's time-consuming for her, but it's very much appreciated and needed.
Any questions?
Thanks.
Thank
All
you.
right.
Environmental, Amanda?
Good evening.
Okay, so we've been really busy with, Rhonda and Steve, been busy with the septic installs and inquiries for new septic systems, home improvement things. Marcy's been busy getting our pools inspected that they finally decided to reopen this year, and along with the tattoo parlors. Our food division, really busy with all the fairs and festivals that are happening right now. With the mill opening, that's almost every weekend, and we have been doing a lot of weekend work with that, not just with the mill, but just overall festivals. We finally finished our first 6 months worth of inspections because we were a little behind. Getting ready to go into our second 6 months to get out all the establishments inspected for the second time. We've had a lot of inquiries for mobile food trucks, a lot, more than normal. And then our general complaints, so like sewage on the ground, trash, pests, that kind of stuff, they've been picking up too. So we've been staying busy.
Very busy.
Any questions? No?
Thank you.
Thank you. Health education?
Hello, everyone.
Ronnie's back in town.
I'm back like I never left. So I actually wasn't here for April and May, so I've been back since I think May 25th was when I returned. So still not a whole lot out of the office, a lot of media, a lot of social media stuff, so still really COVID heavy, but we're throwing in a few other topics in there, food safety, mosquitoes, stuff like that. You guys have any questions for me?
I just wonder, do we ever have funding for like billboards or something like that?
Yeah. Yes.
Okay.
And that's one of the things is that the grant that we just got will be a lot of crossover with the health education because they have all that money to do more than what we have just generally. So, yeah, that will help out our department a lot.
Yeah.
And if you'd like, I can send you out the preset categories of how the money can be spent, because they already designated how much could be spent for personnel, how much for contractual services. So that might help you out as you're thinking, any ideas that you might have to say, hey, I think this would be great to spend it down in this category.
Yeah, and as always, any topics or anything like that that you guys see and you want more of on our social media or want out to the public, let me know, and I'll be more than happy to get it out. Thank you, guys.
Just going to ask, again, kind of the same question, looking forward, using this money for health education. Any areas besides COVID, I guess, that you're thinking you're going to hone in on?
So their grant is just for the COVID, but really, I mean, my job is just kind of whatever comes our way. So, you know, right now, surprise with RSV, but, you know, a lot of mosquito stuff right now, and then, of course, influenza as it comes up. So really just whatever comes our way that's a big deal for the public to know about. Thank you, guys.
Thanks, Ronnie. Would there be any citizen input this evening? Okay. Our next board meeting will be October 20th. I appreciate everybody coming. You've all had a full day of work and have to listen to us. Makes for a longer day. So the meeting will be October 20th. Is there a motion for adjournment?
So moved.
Second?
A second.
All those in favor?
Aye.
Opposed? Meeting's adjourned. Thank you. I don't.
Oh, yes, yes. What's her?